I think we have a good quorum, and let's start. My name is Isa Kipera. I'll be your moderator for this joint webinar on needs assessment findings among refugees in Kenya, which we are co-hosting, ChildFund Kenya and the United States Committee for Refugees and Immigrants, USCRI. We are really honored to have you join us today as we delve into the findings of a very comprehensive study which was conducted to assess the situation of unaccompanied and separated children in Turkana, Garissa, and Nairobi counties in both refugee and host communities. The objective of our webinar today is basically threefold. First, we are going to present findings of this recent assessment, which tries to highlight the protection, health, education, and livelihood challenges that are faced by refugee children. The second is to share strategic insights from USCRI and ChildFund on how we can collaboratively address some of the gaps which this assessment found. Thirdly, we are to engage stakeholders in a dialogue that will lead to actionable commitments and partnership aimed at improving the well-being of refugee children. At the end of this webinar, I expect and we hope to, one, build a shared understanding of the current realities of the facing refugee children in Kenya. Second, to identify priority areas for intervention and collaboration. And thirdly, to amplify a call to action for coordinated multi-sectoral responses that will uphold the rights and dignity of every child, including the unaccompanied and separated children. To guide us in this discussion, we are privileged to have a very distinguished panel, which includes Taylor McNaby, who is the Director of International Programs at USCRI. He oversees programs in Latin America and Africa, leads expansion efforts and manages field offices in El Salvador, Kenya, Mexico, Honduras, supporting refugee and immigrants services. Our second panelist is Dr. Edwin Ocheng, who is the Executive Director of Move On Africa Limited. He's also the lead consultant in this organization who conducted the assessment, which we are going to discuss today, and will present the key findings of the assessment. He's a policy and research expert, and he holds a PhD in planning and management, and he's passionate about driving gender-responsive data-informed development across Africa. The other panelist is Jesus Silva, who is a global humanitarian advisor at ChildFund International. He has over 15 years experience, and he leads refugee initiatives in the Children in Displacements Accelerator. He holds a master's from London School of Economics and works across multiple continents. We also have Victoria Walker, who is a policy analyst at USCRI, advocating for displaced children's rights. She leads the Children's and East African portfolio, shaping policy and advising protection for vulnerable children and youth across regions. Now, since we have already 68 participants in this webinar, we must have some rules to ensure smooth way of engaging in this session. So I would request all participants, so that we have a good record of who has joined our webinar, to put your name in the chat, the organization which you represent, and where you are participating from. So you go to the chat, put your name the organization you're representing, and where you are participating from. I'll also request that we keep our microphones muted unless you want to speak. And if you want to speak, please raise your hand, and the facilitators will let me know that so-and-so needs to speak, and we'll let you speak. We are also encouraging all of you, as the presentations are going on, to use the chat box to post questions or comments during the presentations. During the question answer session, we'll pick these questions and we'll answer some of them. We might not have time to answer all the questions. We'll answer a few, but we'll dedicate time to answer all the questions which the participants would have placed in the chat box. And we request that in case you experience any technical issues, please reach out to us through the chat so that we can see how we can help you. Let's now begin by setting the stage with a brief overview of the refugee operation ecosystem globally and in Kenya, including emerging opportunities, challenges, and opportunities. And to do that is Taylor. So please take it away. And this discussion hopefully will take 1.5 hours, and we should be closing at around 5:30 Kenya time. Taylor, take it away. Over to you.
Thank you, Dr. Issa. Good morning, everyone. Good afternoon, depending on where you're coming from. I see there are people from the US and Kenya on this webinar. So thank you all for your time and for giving us this space. I was asked to give a brief introduction of displacement around the world, and specifically the situation of displaced children in Kenya. I'm sure many, if not all of you, already know that the world is witnessing the highest levels of displacement in its history. This year, it was reported that 122 million people remain forcibly displaced as a result of persecution, conflict, violence, or human rights violations, of which 42.7 million are refugees. The Eastern Horn of Africa and the Great Lakes region hosts over 5.4 million of these refugees and asylum seekers. The major host countries include Uganda, Ethiopia, Tanzania, Burundi, Rwanda, and Kenya. Whether it is owing to persecution, conflict, or climate change, large numbers of people had fled their homes in Sudan, South Sudan, the Democratic Republic of the Congo, Somalia, and Ethiopia to seek safety in a neighboring country. Kenya is one of these countries who have for decades welcomed many of these people, most of whom are children. Kenya hosts over 860,000 refugees and asylum seekers, of which 86% live in refugee camps. The two major camps, Dadaab and Kakuma, are some of the largest refugee camps in the world, hosting 433,761 and 309,169 refugees, respectively. Needless to say, the conditions in these camps are challenging, especially for children. Whether it be food, water, health, shelter, or education, many of the needs of the children in refugee camps are not met. Thousands of children in these camps are unaccompanied, arriving orphaned or without their parents. Many of them end up in precarious conditions, alternative care, or child-headed households. Earlier this year, the US government cut humanitarian assistance that greatly supported the refugee response in Kenya. This has resulted in drastic food ration cuts and the ending of many essential services and programs for refugees around the country. This has particularly affected children. At the same time, only 1,223 refugees have been resettled to third countries from Kenya in 2025, despite the fact that the refugee camp situation is not sustainable as it is. Even before these funding cuts, many facilities and programs for children in Kenya's refugee camps were left underfunded or in disrepair, a classic example of donor fatigue in the face of protracted displacement situations. Earlier this year, child protection infrastructure in the camps had been devastated by aid cuts, where staffing shortages leave vulnerable populations at risk. This includes psychosocial assistance for survivors of gender-based violence and case management for child-headed households and unaccompanied children in alternative care. These gaps create the potential for abuse and exploitation. Furthermore, child-friendly spaces and playgrounds operated by NGOs have either been closed, in disuse due to understaffing, or on threat of shutting down, depriving children of the few opportunities they have to play and learn. Most girls in these camps make do without sanitary pads and other menstrual hygiene products, leading to health concerns and increased school absenteeism. Despite these immense challenges, while some NGOs are closing shop and reducing presence because of decreased funding, it is important to recognize that refugee-led organizations and other community-based initiatives remain on the front lines, providing community-based support and care, moving mountains, and becoming protagonists to finding solutions through their Herculean efforts. We should highlight that the Republic of Kenya is a party to the 1951 Geneva Convention, its 1967 Protocol, and the OAU Convention governing the aspects of refugee problems in Africa. Additionally, Kenya has also ratified the Convention on the Rights of the Child, of which Article 22 guarantees humanitarian assistance and protection to children who are refugees. At the national level, Article 53 of the Constitution of Kenya guarantees all children the right to nationality, education, nutrition, shelter, health care, parental care, and protection from abuse and neglect. It also enshrines the principle that the child's best interests are of paramount importance in every matter concerning the child. The Children Act of 2022, an act of the Parliament of Kenya that gives effect to Article 53, includes children who are displaced as a consequence of war, civil disturbances, natural disasters, or otherwise refugees in its definition of children in need of care and protection. In short, refugee children are first and foremost children and should be treated as such. They are also entitled to certain protections under international and Kenyan law, which NGOs such as ours are actively seeking to support the government in keeping that promise. While Kenya has been welcoming and providing international protection to refugee children for decades, there are enormous gaps to be filled to guarantee their well-being, making this needs assessment between USCRI and ChildFund very timely. USCRI remains committed to advocating for refugees in general and refugee children in particular, and commends ChildFund Kenya for their commitment to expand their programming to serve refugee children in the country. And with that, I thank you all for your time and pass along to the next speaker.
Thank you very much, Taylor, for keeping time and raising quite some pertinent issues. And if you look at the statistics, you will understand the whole issue of refugees being quite like a crisis in our region. With that, I hand it over to Edwin, who will share with us the findings of the assessment which was done by ChildFund and USCRI. Over to you, Edwin.
Yeah, thank you, Dr. Issa. Thank you, Taylor. My colleagues, all distinguished participants who are part of this webinar, allow me to present to you the findings of the needs assessment that we were able to do looking at children's programs in refugee context, host communities. This is a study that we did in Garissa, Turkana, and Nairobi counties, and provides insights into how, what's the situation of unaccompanied children within the refugee context. So in my presentation, I'll speak briefly about just a background context, building on what Taylor has already talked about, share how we were able to conduct the study, but also provide some contextual background underpinning the findings for the study, draw conclusions and recommendations, then invite you to be able to relook into those recommendations together with us, just to appreciate the outcome of the finding. You can proceed. So the study purpose was generally to find out what are the needs, what are the vulnerabilities faced, especially when we speak to unaccompanied and separated children between the age of 10 to 14 years, and also see how this can help inform program delivery and be able to make them more responsive, especially when you look at the issue of inclusion, sustainable child protection, and development interventions. You can move to the next slide. In this needs assessment, one of the things that we were able to do is map the priority needs, as just I've mentioned, but also look at what are the existing sector-specific partners and what are they doing to be able to address the needs of refugees, identifying gaps in service delivery, but also collecting views from children and their caregivers, including government, to appreciate and understand what are some of the relevant interventions that are effective and impactful that are being undertaken by different actors within the space that they are into. So I will be speaking to that just to appreciate how those views came across. In this particular study, the focus was in Kakuma, Kalobei region, and Turkana, Dadaab in Garissa, and of course in Nairobi, we focused on Eastleigh, Kasarani, Kawangware, but also refugee children between the age of 10 and 14 years. Our study approach, just to make sure that it was scientific, focused on a mixed method approach that built onto quantitative and qualitative data collection techniques. In our quantitative, we spoke to caregivers, around 361, who provided their views, perspective, and opinion around the needs of unaccompanied and refugee children in host communities and within the refugee camps. We had also opportunity to use participatory methodologies using FGDs, key informant interviews, and case studies to be able to appreciate and understand, speaking to caregivers, children, teachers, child protection officers, health providers, and community leaders. This methodology also emphasized the importance of appreciating gender equality and social inclusion, but also the reality is that when you undertake a study like this, ethical considerations become very significant to ensure that we speak to the lived realities of the population and ensure that after the study, there is no harm done to the vulnerable populations. This table provides just the demographics of the distributions of the respondents, how we were able to mobilize, but also how we were able to speak to the different participants across the different regions. In terms of the background, I wouldn't speak much about this because Taylor already mentions this, but we all appreciate that Kenya is one of the top refugee hosting countries. And that means that it is important that interventions that speak around humanitarian work and development work appreciate the lived experiences of refugee communities. This means that for those of us who work closely with children, then understanding the layered vulnerabilities caused by displacements, family separations, poverty, and exposure to violence then becomes very significant. It's even more significant if you speak to a population between the age of 10 and 14, who then experience displacement due to multiple realities that we all are aware of that affect refugee communities. In this particular context, in Nairobi, Turkana, Kakuma, and Garissa, Nairobi is largely the home of urban refugees, primarily residing in informal settlements in Eastleigh, Kayole, Umoja, and Kawangware. Often, they lack formal documentations, they lack legal recognition, but are also invisible when it comes to policy development frameworks done by government, both at the national and at the county level. And this poses them to a lot of vulnerabilities such as arrests, police harassment, and exploitation. Refugee children in urban areas face significant risks, including dropout, early child labor, violence that happen and mainly affect girls and women, especially in the informal areas due to issues of gang-related activities. In Turkana County, which is home to Kakuma Refugee Camp and Kalobein Integrated Settlement, it hosts the second largest refugee hosting communities in the country. When you speak about Garissa, in Dadaab, it has very complex, and it includes 3 camps, Hagadera, Ifo, and Dagalei, and mostly host majority of refugees who are asylum seekers from the Somali community. The areas face long-standing humanitarian pressure, including constrained mobility due to security concerns, frequent outbreaks, and poor wash infrastructure. Vulnerable and unaccompanied separated children are among the most affected within this population. And when you look at the institutional landscape, already we are aware of the work that the government through the Department of Refugee Affairs is doing under the various established refugee acts that are responsible to provide for refugee management and coordination. Kenya has also adopted a number of frameworks, including the National Care Reform Agenda and other related policies that ensure that families and community structures are able to address and take care of vulnerable populations. Key challenges we found out, one, as you see from that particular presentation, we have neglect. We have also cases of alcohol and drug abuse that affect families living with children between the age of 10 and 14 years. There is mental and emotional abuse, aspects of child marriage, depending on communities, but also sexual violence and abuse and child labor are significantly some of the identified violations that affect unaccompanied children within the host and refugee communities. Our study findings indicate that when you look at child protection risks, then majority of caregivers acknowledge first that within the communities and the societies where they live, 95% of the respondents indicated that they are aware of unaccompanied and separated children. And that is very significant because if you speak to people and they tell you, yes, we have this category of population in the community who face multiple risks that are overlapping and which include, as I've indicated, child labor, almost 71%, physical abuse, 70%, according to respondents interviewed, neglect, child marriage, and sexual abuse. When you look at these numbers, they are pretty very high. And this is attributed to some factors such as absence of parental care for unaccompanied and separated children that then lead to exploitation and psychosocial distress and social exclusion. There is a quote here that provides and really indicates how the situation is. Children are more often forced and coerced into work that is harmful to their health, development, and education, frequently under hazardous conditions. This is an FGD that was done with boys in Dadaab in Garissa County. The absence of parental care leaves unaccompanied and separated children vulnerable to exploitation, psychosocial stress, and social isolation. The risks are further exacerbated by structural factors known to us: poverty, inadequate adult supervision, weak child protection system, especially when it relates to refugee communities, and also harmful practices, just as we'd already mentioned earlier. Girls within communities are exposed to child labor, working in different households to earn a living for their families. For example, some of the girls do the work on behalf of their parents and doing washing and cleaning and fetching water for other families when their parents are unwell or engaged in other activities. When it comes to health and nutrition, the study also identified a range of common health-related conditions affecting children, talking about malaria, diarrhea, malnutrition issues, respiratory infections, skin conditions, anemia, and mental health challenges. Access to healthcare service still remains limited, with only 31.3% of caregivers interviewed indicating that unaccompanied children and separated are able to access quality healthcare. I use herbal medicine instead, but it takes a long time to feel better. Key barriers include poor service provision, high cost, long distance to facilities, but also lack of documentation that hinder access. There is also fear and stigma, especially depending on the condition of the health-related issues for their families and also for the refugee children. Malnutrition emerged as a major concern, with 80% of respondents acknowledging the presence of this among unaccompanied and separated children. Factors identified include food insecurity, poverty, lack of dietary diversities, and also inadequate health and nutrition education. Children experience malnutrition also suffer from stunted growth, impaired learning, and increased susceptibility to illness. Within the domain of reproductive health, it's also mentioned that unaccompanied and separated children face challenges when it comes to some of those particular services. Teenage pregnancies are also common, disrupting girls' education and exposing them to serious health risks. Additionally, poverty contributes to poor nutrition. Some girls attend school without having eaten, which affects their concentration and well-being. There are financial hardship within families and caregivers that take care of these children, which also provide certain structural barriers. Psychosocial and mental health, one of the areas that we're also able to look into, show that unaccompanied and separated children experience significant stress due to separation of families, lack of emotional support, but also exposure to abuse. Particularly, girls face additional burden such as risk to early marriage, sexual violation, and also mental health needs for their caregivers was also highlighted as one of the things that provide that level of emotional distress. When you look at education, access to education is still limited, and only 35.6% of caregiver respondents believe that unaccompanied and separated children have access to quality education within the respective areas, with access being lowest in Turkana. Barriers, school fees, lack of learning materials, overcrowded classroom, long distances to school. Again, we must reiterate that legal documentation and also trauma and language barriers play a significant role. That means that when you look at it, you see that most of those who indicated that children are able to access learning facilities attributed this to support primarily from non-governmental organizations that work within those different spaces to address gaps in terms of ensuring that they can be able to go to school. But gaps exist among caregivers' involvement, and especially government support still remain less. When it comes to, I've already spoken about that. I will speak to food security issues, which also is an area that we looked into, and majority of households caring for unaccompanied and separated children struggle to meet basic needs, with only 12.7% of respondents being able to indicate they're able to afford all household essentials, such as food, clothing, healthcare, shelter, and education. I do not have sufficient food for my family because I depend on food aid provided by organizations. When the donors stop or fail to support the organization, we face challenges in accessing food. Some of us even remain hungry or limit the meal size that we take from a day. That's a quote from a caregiver, just indicating how dire the situation is. So food security for the unaccompanied children, as I've mentioned, remain one of the factors that impact negatively on their children, and some of the factors that and how they cope with such factors is that they reduce their frequency of meals, borrow food or money, skip meals, or rely on food aids. According to the Food Consumption Score, they indicate widespread food insecurity, with 52% of households having poor food consumption and only 9% achieving acceptable diet diversity. Barriers to food security, restricted movement, limited access to employment opportunities, insufficient food aid, but also related infrastructure problem, and inflated market prices for some of the foods that they depend on. In conclusion, the assessment paints a concerning picture of the lives of unaccompanied and separated children in refugee and host communities in Kenya, and the intersection of multiple underlying vulnerabilities, looking at poverty, limited access to services, weak social safety nets, and systemic gaps in child protection places. This pose a lot of harm to the children. However, it also highlights the resilience of caregivers and their potential for coordinated intervention if state and non-state actors can be able to work together and provide coordinated response. Some of the recommendations, largely strategic, is looking at how to strengthen and make sure that child protection community-based system also support vulnerable unaccompanied children and in the refugee context, that there needs to continue to engage government to increase their responsibility, but also increase coordination among humanitarian actors. And I think the current Kenyan government has really made some significant positive steps provide psychosocial support, especially for caregivers, because these vulnerabilities you already see is causing a lot of mental health issues, but also scaling up issues of food security and nutrition programs, and expanding access to services, and looking at how to address those challenges that have been mentioned, so that access to services such as quality education, health services can be expanded and can benefit unaccompanied and refugee children within the refugee context. Allow me to stop there, invite the next speaker to be able to take over. Thank you. Back to
Thank you
Dr.
very
Issa.
much, Edwin, for that very good presentation of the assessment we did. We have all seen the challenges which refugee children are facing, from neglect, drug abuse, to mental abuse, to child marriage, all that, and the way they are not able to access basic services. So now we want to see what measures and strategies is the USCRI employing to address some of these challenges. Not that we are able to cover everything, but the efforts which we are making, which will then call upon others in this webinar to join hands with us so that we can address these challenges which unaccompanied and separated children face. Over to you, Victoria, for the presentation.
Thank you so much, Dr. Issa, and thank you to all of the colleagues on today. As Dr. Issa mentioned, it's impossible to cover everything, but after Edwin's comprehensive presentation of the needs assessment, I just wanted to provide some briefing notes from USCRI about both our programming that we've employed to address some of the needs that Edwin outlined, as well as some of the advocacy messaging that our policy and advocacy team continues to put forward when it comes to upholding the rights and addressing the needs of refugee children, and specifically unaccompanied and separated children. So I also wanted to note just a big thanks to all of the colleagues on the call today. I know many of you, there are some I hope to meet in the future, but just wanted to thank you for the work that you all put in on a daily basis to ensure that refugee children in Kenya are protected and that their well-being is put first. I do want to note that we are convening at a critical time for children in migration and displacement settings globally, and this is particularly true for unaccompanied and separated children. We're witnessing policies rapidly change and conflicts and crises continue to escalate around the world and in the East Africa region. And as this all plays out, we've seen a concerning diversion from the once strong consensus that all children have rights, that they should be protected, and that they are worthy of a childhood. So I'm really pleased to be a part of this important dialogue today as we urge policymakers and all stakeholders to take immediate and coordinated action to protect refugee children, unaccompanied and separated children in Kenya. From our advocacy team at USCRI, I can say we have and we will continue to underscore that unaccompanied and separated children are children first and foremost. They have rights, and we all have an obligation to ensure that these rights are upheld. USCRI is a longstanding care provider for unaccompanied children in the United States. And so when establishing our operations in Kenya, we aim to contribute this expertise through our collaboration with other child-focused experts, organizations, and most importantly, through collaboration with refugee-led organizations in Kakuma, in Dadaab, and in Nairobi. Children make up the majority of the refugee population in Kenya, over half, and so any response, especially if we want to see sustainability, must include children, and it must include their meaningful participation as well. I myself have visited Kakuma and Kalobei twice, and once to Dadaab, as USCRI sought to examine the situation for children in the camps, specifically as it related to child protection and access to education. And from this was back in 2023, we were able to compile policy reports and develop partnerships such as this collaboration with ChildFund, but it also informed our programming. And so in the US, we are caring for unaccompanied girls in particular. So our programming in Kenya has a unique focus on unaccompanied and separated girls. So I just wanted to touch on that a bit today in my briefing to all of you. We know unaccompanied and separated girls experience heightened and intersecting vulnerabilities. We've heard from Edwin and from others on the call through the needs assessment. We've seen things such as child marriage, gender-based violence, barriers to education access, and these are often heightened for girls. A piece of particular concern for our team was access to menstrual health education and menstrual hygiene products for girls in Kakuma, Kalobei, and Dadaab in particular, and how this caused so many girls, especially in secondary school, to drop out of school or retreat from community life or experience significant health complications. So we saw this as an urgent and often overlooked issue. And in response, we were able to launch our Keep Girls Dreaming initiative in October of 2023 to provide menstrual hygiene products to girls and women in the camps. In January 2024, we were able to deliver over 500,000 sanitary pads to Dadaab, Kakuma, and Kalobei. Today, I'm really thrilled to say that through collaboration with refugee-led organizations, some of whom I see on this call, community actors, and our team in Kenya, our wonderful USCRI team in Nairobi, Keep Girls Dreaming has now grown from an initiative into a program, and one that will specifically focus on unaccompanied and separated girls in Kakuma. So starting in November, and I think Taylor can detail more of this if there's any questions, the Keep Girls Dreaming pilot program will focus on improving menstrual health and hygiene for unaccompanied refugee girls, while also supporting foster caregivers and strengthening the role of local community-based actors. The program will include peer-led education, menstrual hygiene workshops, and the distribution of dignity kits and school supplies. This pilot program aims to serve 100 unaccompanied and separated refugee girls aged 8 to 14. It aims to distribute dignity kits to 4,000 refugee girls and support 50 foster families, as well as train 20 peer mentors from a group of older refugee girls. And I personally love that part of this program because it's engaging girls with their own community, their peers, those they trust, and those that they look up to. And that's so important. And we're really thrilled that this will involve the collaboration with local refugee-led organizations. As the pilot program begins, I'm happy to say that after a successful appeal around October's International Day of the Girl Child, USCRI, as part of our Keep Girls Dreaming initiative, will be delivering and distributing over 800,000 sanitary pads to Kakuma in November, so next month. So please stay tuned. I just wanted to echo some of the comments and outlining that Taylor made earlier about the cuts to foreign aid. And I just wanted to underscore from an advocacy perspective and policy perspective that this has caused a significant shift in the realities we're seeing for children as a whole in the camp, but especially for unaccompanied and separated children. Cuts to foreign aid by the United States and other major donor governments have increased levels of risk for children, rising levels of hunger, instability in the broader region. Protection systems are now forced to operate with restricted funds and restricted support. Within this reality, it is of the utmost importance that all of us are still reiterating that whether a child is accompanied or unaccompanied, it is their right to be protected and given assistance. Even in transit, the rights and protections of unaccompanied children must be upheld. I wanted to highlight child-friendly spaces and the importance of urgent and flexible funds designated so that child-friendly spaces can provide immediate care to children and especially assessment for protection concerns. And that especially goes for unaccompanied and separated children. This is often the space in refugee camps or in reception centers that children have a safe space to just be kids. So wanted to flag that for all of us on this call. And just to conclude, to reiterate what all of our colleagues have said today and what I know many of you work day to day to ensure that it is important that unaccompanied and separated children, refugee children, all children in migration and displacement are seen, heard, and included as active participants in molding their own futures. So I'm really looking forward to hearing from all of you on the call today and continuing to hear more from colleagues. I will stop there and pass it off to the next speaker. Thank you so much.
Thank you very much, Victoria, for that very succinct presentation. I think you have quite presented the challenges that unaccompanied and separated children are facing and what USCRI is doing, especially in the area of mental health and menstrual hygiene. We look forward to the November 1,000 sanitary pads was it Kakuma? Yes, in Kakuma. So please, let's join USCRI to provide more of this support to the girls in the refugee camps. With that, we move to the next presenter, who will tell us what ChildFund is planning to do to engage in refugee programs. So, and with that, I call upon Jesus.
Well, thank you so much, Dr. Isa, and of course, thank you to the team for organizing this meeting. Also, thank you to our colleagues from USCRI. We really appreciate your collaboration and all the work that you have been doing as well. And just thank you for all for being here and also for the time that you are putting to this webinar. So thank you so much for attending. What I'm going to show you now, it's basically what ChildFund has been doing in the past 5 years.
Can you put it on full slideshow?
Oh yes, of course. Sorry.
Yeah, sorry for that. Thank you very much.
Okay. So I'm going to show you what ChildFund is. Basically, I'm sure some of you don't know the organization, and I think this is also something important that we have to take into account. And I'm going to show you just a snapshot of some of the humanitarian projects that we have around the globe, and especially in Africa. And finally, I'm going to take you through some of the actions that we have been doing in Kenya, and also specifically actions related to the assessment that we just heard from Edwin. And who are we as ChildFund International? We are an organization that is a child-focused global nonprofit, which is dedicated to connecting children in vulnerable communities with the people, the resources, and the institutions they need to grow up healthy, educated, skilled, and safe. And some of those institutions and some of those people are here in the room, in the call, sorry. And our work basically addresses complex humanitarian challenges driven by conflict, economic instability, and other sources of conflict, focusing basically on migrants, refugees, and internally displaced persons. And of course, we also have work on the development sector, but I want to focus, of course, in the humanitarian sphere and well with the refugee population that we work with. ChildFund is also part of the ChildFund Alliance. This is a global network of 11 child-focused humanitarian and development organizations. And with that, we work in 70 countries with more than 30 million children, families, and their communities across Africa, Asia, and the Americas. You can see here the countries where we work on and some of the countries that the Alliance members work. Just let me know if you can see it. Yeah. Basically, at ChildFund, we want to have a holistic approach to the humanitarian response. And we work basically on 4 thematic areas, which is protection or child protection, youth agency and livelihoods, health, and education in emergencies. And we have worked globally, reaching more than 500,000 migrants, refugees, and internally displaced persons, and with the goal of protecting and empowering children and youth impacted by crisis through integrated interventions in these 4 thematic areas. Of course, we also work in other areas, but these are the main focus of the interventions that we have globally. And a key feature that we have is that ChildFund, since its inception, has been working through a locally led approach. And this has become more important in the past few years, actively partnering with local organizations for more than 50 years already. And we have implemented locally led solutions to the most pressing issues affecting children and their communities. We have also committed funds for these local organizations. We have exceeded $46 million annually to approximately 145 grassroots organizations in 20 countries in Africa, in Asia, and also in the Americas. And this is an important part of the work that we are doing. And also in Africa, this, as Victoria already mentions, also for us is really important to work with the refugee-led organizations, with local organizations, with community-led organizations that are working in the field and that know the needs and the capabilities that the communities have in the country. So I wanted to share a few interventions that we have in Africa to protecting children in crisis in key countries and some of the reach that we have had in those countries. In Uganda, as you know, one of the largest refugee hosting countries in Africa, we have reached more than 20,000 children and an estimated of 100,000 adults in refugee programs. Specifically in Uganda, we have been working in a few projects in Paralinia refugee settlements close to the border of South Sudan. So we are working there through refugee-led organizations and through community-led organizations as well. In Ethiopia, we are responding to internal conflict displacement in northern Ethiopia and some of the climate disasters that we have been suffering in that country. We have supported more than 15,000 displaced people by conflict, and we are currently engaging with several organizations and also with UN agencies to respond to this internal conflict and also the climate disasters needs. In Kenya, I'm going to focus more on the response that we have been doing in the past few years. And we have been responding to the prolonged drought and the climate-triggered conflicts that we have in the country. More than 270,000 people have received emergency cash transfers in the projects that we have been able to perform. And we have been also trying to respond to the needs that we have identified in the needs assessment, showing we have put a small intervention showing the commitment that we have to address the needs found in the needs assessment that Edwin just shared with us. And this needs assessment that was conducted in collaboration with USCRI and ChildFund has provided a baseline for our intervention design and also taking into account the needs of the affected populations and the voices that they have, of course. And this is also a key part of the design of the projects that we are having. And just getting feedback from the community, getting feedback from the affected population, and including or incorporating that feedback in the actions that we are doing. In the case of this pilot project that we have initiated in Kenya, specifically in Kayole, Kasarani, and Nairobi County, the project is focused on enhancing food and nutrition security for refugee children and families. And even though this is a small project, we are aiming to scale it in the following years, because as you have seen in the assessment that Edwin presented, we have a lot of needs in not only in the Nairobi County but also in Garissa and Turkana. So we want to scale it to other counties as well. The goal is basically to improve access to nutritious food and strengthen household resilience. As you have seen, one of the main needs of that we have found in the assessment is access to food, and the worry that the families have that they will not be able to support their households with basic food and services. We have an aim of 120 refugee households, approximately 720 individuals, and this includes 600 children and 60 women or caregivers as well. We are focusing on specifically 2 areas, but we are also coordinating and, of course, in partnership with a lot of organizations, and just taking into account the affected populations and all the needs and the changes that they need in the programmatic support that we are providing. We have a focus on increased access to food security, and secondly, on strengthening the capacity and the resilience of the families there. And some of the key activities that we are providing is basically we're giving cash and assistance to 120 refugee families that will receive a 1-month non-conditional cash transfer to purchase nutritious food locally. We are also supporting livelihoods through income-generating activities, and also we will be giving startup kits and seed capital to the entrepreneurs, and also trying to provide caregivers with training for entrepreneurship and voluntary savings and loaning schemes, as mentioned in the assessment, and this is something that they really required in order to be able to provide to their families. In terms of nutrition, which is also a key component, which is responding to the assessment, we are providing training and nutrition education, nurturing care, cooking demonstrations, and hygiene by this county, and also some nutrition officers that we are coordinating with. And just in terms of the coordination and the partnerships that we are doing in the county, the project, of course, is leveraging on the existing structures that the government has and other NGOs already working there have. And we are also building capabilities in agriculture and nutrition with these organizations and with these government officials as well. And in our commitment to accountability to affected populations, we are also establishing complaints and feedback mechanisms, and we are using also ChildFund's accountability to affected populations framework and guidance, and actively engaging participants in all phases of the project. Basically, as I said before, taking into account the feedback that we are receiving in the design, in the implementation, and of course on the monitoring and evaluation that we will have for this project. So this is basically what we are doing in Kenya to respond and to show our commitment after the assessment that we have performed. Even though this is a small intervention with small funding, what we are expecting is to have or to scale this type of projects in the next couple of months, and just trying to address all the needs that we have identified jointly with the USCRI in the refugee camps and also in Nairobi County. So this is what I wanted to share, and well, thank you so much. Back to you, Dr. Isa.
Thank you very much, yes, Lucy, for that excellent presentation, taking through the participants, what ChildFund is doing, with a focus on the 4 priority areas of protection, youth agency, health, and education, and outlining how the organization has picked the findings of the assessment and implementing what I could call a pilot for urban refugees for food and nutrition security. And you can realize the project will only target 120 households, while we know for sure there are many more refugee households with unaccompanied and separated projects, children in Nairobi or in any other urban center for that matter. And that shows we require more support in this area if we are to address the challenges and gaps which the assessment identified. So we'll move to the next sector, which is 15 minutes of question and answer. So I will pick 2 or 3 questions from the chat, and then I will allow another 3 to 4 questions from the participants. So I would like participants who have questions to raise their hand, and I'll go by whoever raises the hand first, and then I will unmute the microphone to speak. So let's take a few of the questions from the chat. There's a question from Nancy Njeru, who first appreciates the presentations being very informative. And from the assessment, she's asking, were we able to pick out challenges faced by children with disabilities or households with caregivers with disabilities? I think this goes to the consultant, Edwin. Over to you, Edwin. Can you answer that?
Yeah, thank you so much. Certainly, yes. Part of one of the things we integrated in this study was gender equality and social inclusion approach, where we also spoke to children within the refugee context who are persons with disability. And what came out strongly was the issue of stigma and lack of assistive devices. In it that there are very few organizations that have targeted interventions to provide, especially assistive aid and services for refugee children and unaccompanied children. And then the whole issue about stigma among families and caregivers who take care of refugee children. Those who are within the school setup, a number of schools, there are already interventions by different organizations like Humanity International in Kakuma that seeks to ensure that the school environments are disability friendly. But again, that effort is still not good enough, and that also poses challenges. Some of the approaches that are used is like where you have buddy systems that are used for especially children with disability, where their buddies are able to support them. And that also relates to the issue of long distance to access to services, which mainly emerged from caregivers and children with the disability situation. Back to you, Dr. Ari.
Thank you for that, Edwin. Now I go to the next question, which I've picked from the chat, which is being asked by Samuel Kariuki. And Samuel Kariuki is asking, to what extent has Shirika Plan program launched in March by the Kenya government helped to alleviate vulnerabilities among unaccompanied refugee children? I'm not sure who to lead this question to, but I would maybe ask Taylor or Victoria if we have any information on this, and then Edwin will chop in. Victoria.
Yes, thank you so much, Dr. Issa, and thank you so much for this question. I think it's of great importance to bring up the Sharika plan and how this sets the stage, I think, for policy, refugee-centered policy as a whole. So I will say that maybe speaking to how it has alleviated things for unaccompanied and separated children, potentially folks in Kenya would be better to speak to this. However, we have conducted an analysis from our policy and advocacy team on the Sharika plan and compiled some recommendations alongside our office in Nairobi. And so I think first to say any plan like the Sharika plan that is getting away from encampment policies and aims to have a more inclusive, refugee inclusive policy and outlook is important for refugee children and important for unaccompanied and separated children because this sets a community, it sets families, it sets caregivers up for greater success, dignified realities. So the plan in its ideal and the potential that it holds definitely sets a precedent for humane and forward-looking policy that would benefit children. I think some of the recommendations that we put together and I think would apply to addressing the needs of unaccompanied and separated children would be one, to deepen community engagement and transparency. And I think we've seen some difficulties with that thus far in making sure that refugee communities, host communities, local governments are well informed on what the Sharika plan means, what it outlines, how it actually will come to be, what are the tangible action steps. And so I think the more we can have structured dialogue forums that include refugee and community members, the better. And this means ensuring meaningful inclusion of marginalized groups, such as child-focused groups and, with proper safeguards, making sure youth and children are able to input into such dialogue. I think children with disabilities, that was an incredible question and so important. I think that's another group. People with disabilities as a whole need to be included in these in this engagement. I think also improving communication and coordination amongst stakeholders, all of us, making sure that those with child protection expertise are in the dialogues, are forming the action steps on how to bring the Sharika plan to reality and bring it to light. I think lastly, for children, the other recommendation we had around the Sharika plan was to ensure that it aligns with national legal and policy frameworks. So making sure that children are included, refugee children, included in the national policy framework, included when we're talking about education, when we're talking about protection, that refugee children, whether they are in Kakuma, Kalobey, Dadaab, Nairobi, that they are included in the policies overall for Kenya and the broader region. I will stop there. I don't know if Taylor or any other colleagues have anything to add.
Thank you, Victoria. Any of the panelists having something to add? Yes, Edwin?
I just want to add, and I think this is a question for even all the participants present here, and especially looking into those who work within the refugee setup. But one of the things we found out is that the rollout for the Sharika plan, apart from the launch that was done, there hasn't been the framework for how this should be rolled out, though exists within the Sharika plan, hasn't been actualized, and some assessment may need to be done. Just look at what are the institutional steps that have been taken by government, because there is a lot of institutional setup in terms of programmatic delivery and coordination between UN agencies, government agencies, and other actors. But it's a bit more slow, and it will be a bit early to begin to assess to what extent it has been implemented, because it's when the coordination committees and other structures that are being established. Of course, a lot of this work on the Ushirika plan builds from the interventions and the processes that development actors have been doing, and which largely already inform some of the processes. So it's not that work is not going on. If you look at some of the actions by non-governmental organization development partners like UNICEF, EAS, UNHCR, when we looked at some of the already things that they are doing, you will see it already built into the plan. But a systematic approach is what is being rolled out currently through government intervention and development actors.
Thank you. So the next question, I think, has been partly answered. It's from Sarah Musenya. I hope I've pronounced the name right. Sarah is asking, how are these interventions, the interventions we have outlined from USCRI, sorry for that, and ChildFund, anchored on existing government systems and structures in light of the Ushirika plan? I think we have partly answered this, but it does no harm if we can just emphasize on how those are aligned or are anchored on existing government systems and structures. Victoria, how is the program which we are targeting these young girls with this menstrual hygiene and sanitation interventions anchored on existing government systems and structures?
Absolutely. Thank you, Dr. Issa. I'll say one, I think, highlight point, and then I'll actually pass it to Taylor because I think he'd be able to feed in more detail about the program. But I will just say, I think one of the largest pieces for us is that we are in deep collaboration with refugee-led organizations and community-based organizations, because I think as it relates to the Ushirika plan, within that work and constructing this pilot program, it's been at the core to have that collaboration and transparency and community engagement. And so I think refugee-led organizations have the expertise, they have the best knowledge of what the needs are, what is happening on a daily basis, and to be able to collaborate and have mutual support, I think, is a big part of fostering greater community engagement. And that's part of what our program is aiming to do. But I'll pass it over to Taylor. I think he can detail that a bit more.
Thank you. Taylor?
Thanks, Victoria. You took the words right out of my mouth, but I can add to that as well. I think just wanted to reiterate our engagement with refugee-led organizations, especially as the Keep Girls Dreaming initiative expands, is definitely paramount, and I think goes hand in hand with the Ushirika plan, in the sense that I don't think refugee-led organizations are explicitly mentioned, from my understanding, in the plan, but please correct me if I'm wrong. But I feel like if there's a key word of the Ushirika plan, if you could sum it up into one word, it's the self-reliance is the key term of it, right? Refugee self-reliance and community-based support systems. So RLOs, refugee-led organizations, are really the key piece to that. And in terms of, I believe there was also Sarah mentioning government systems. So, I mean, we have a very strong partnership with the Department of Refugee Services, DRS, who are, for those who may not know on this call, is the agency that's mandated to serve refugees from the government of Kenya perspective. So we have a very good relationship established with them, and we'll continue working with them as an essential partner as well. They are also on the steering committee along with UNHCR of the Ushirika plan. And of course, also with UNHCR, we will be working closely. Although they're not a government agency, they're also a very important stakeholder in terms of managing the refugee camps in particular, and providing a lot of essential services to refugee children.
Thank you. Now I'll take the question and answer to the participants who would unmute and speak to us. And the first goes to Paris-Ref-CA. Please, can you unmute and speak? Are you able to
Hello,
unmute?
everyone.
Yes, please. Go ahead.
Thank you. Thank you to the host and to Taylor and everyone and the team at the USCRI. My name is Paris. I work with Refugee Coalition of East Africa. We are a queer-led coalition that unites several CBOs in East Africa, but we are based in Kenya. First of all, congratulations on the needs assessment report. It's really needed, especially right now when we are struggling with the adjustments around the world with funding and everything. It makes more case for us to have accompanying data. So my question will be like, is there any area of collaboration for queer refugees and parents who are queer and their kids? I haven't heard anything around that area. And also with the Shirika plan, there is so much exclusion when it comes to queer refugees. If there is some chance for collaboration, just know there is this community of queer refugee kids and their parents, and we are ready and eager to work with you to see that these kids are also not left out and to be included. Thank you.
Thank you very much for that very good question, which points to a segment of a very vulnerable group and which requires attention. So I don't know who is going to pick that. I'm looking at that. Taylor, do you want to give it a try and then maybe yeses?
Yeah, sure. I can start. It seems your question had two parts. So in terms of interventions serving LGBTQ and queer families who are refugees, our interventions at present for USCRI, at least, we're working with unaccompanied children who are in alternative care settings or in some cases in child-headed households. So that pilot program does not have any particular specificities for working with LGBTQ families, but we also recognize the the need there for services. It's just not in the purview of our pilot program. With regard to exclusion in the Shrika plan, that is heard and understood by me, and I think that's definitely something. Paris, you and I have been in discussions before, definitely willing to talk about that with you further, but this is something that I've been in discussion with other stakeholders in terms of including certain groups of particularly vulnerable refugees in the inclusion of the Sarika plan. I think Victoria touched upon a little bit about how I think communication has been difficult with the community as a whole, but then in particular with particular groups. And I think LGBTQ refugees are definitely one of the groups that hasn't that hasn't really been addressed in that planning.
Yes, any addition, especially in the perspective of the urban programming?
Yeah, so for us, and this is talking about the programs that we have globally, we have worked with the LGBT plus community extensively. But in the case of Kenya, for children in these situations, we are focusing on creating safe and inclusive environments where they can thrive. This is basically our mandate and our mission. Also, as we are in the early stages of the pilot project, we haven't identified some of these concerns. But in other projects that we have globally, we have worked with psychosocial support, offering tailored mental health support also for children that cope with certain traumas or addressing feelings of isolation and building resilience. So this is part of the services that we have globally, and if we see this need within the project that we are implementing in Kenya, this is something that we can bring to the table and to the pilot project that we are having now in the country.
Thank you very much. And I don't see any other hand which is up. Yeah, here it comes. EEAH refugee. We are running short of time. We are 2 minutes past this session, but I will allow that question before we move to the last session of our day. Over to you, EEAH refugee Kenya. Introduce yourself and then ask your question.
All right. Thank you. My name is Joseph Serwaji, and I volunteer with the Entrepreneur Empowerment and Advocacy Health. We are a refugee-led organization, still working with the underprivileged ITGNC, displaced refugees and victims of violence. And to this, I must say that we indeed acknowledge good work, because Indo advocacy has always yielded more than what we always imagine. However, I must say that the Shirika plan itself is a Trojan horse that intendedly comes to exclude the queer refugees, as everyone has put it, and to very many of our people today. All these programs require documentation, which by percentage our people do not have. We have refugees who have been in Kenya here, and they're not mandated. They can never in one way or the other be beneficiaries of some of the programs that you yourselves or the UNHCR or the government of Kenya would want to implement. So it is imperative for us to note that while the different partners engage in Indo advocacy, it is our desire as the grassroots members that you wish for the administration here to pronounce its position on queer people, on the queer refugees, because there is no way we are going to extend, the ChildFund will extend aid when the queer refugees are not acknowledged. There is no way this aid will get to the grassroots when the acts, the PBO acts that are being instituted by the government here are coming for the organizing of the grassroots organization. So we call upon you where we cannot reach to be the very voices that can speak louder for us. And I must say, we have the numbers, we have the data, we can feed you with the very things that we are talking about. These are not just speculations. There is need for your input on quite a number of these, because it is of urgency. Thank you.
Thank you very much. Thank you very much for that. I think that it was more of a comment than a question, and we take your comment very seriously. And I think we need some work on this category of refugees so that we understand it better. And it's important that the organizations which are advocating these groups have participated in this particular webinar, and we'll link up to see how we can work together in addressing the challenges and the gaps within the refugees in the country. So with that, I would request that I move to the last session of our discussion today. And I would want to call upon Victoria Walker to amplify to us the call for action so that we know exactly what do we need, steps we need to take moving forward, so that some of these challenges and gaps identified in the assessment can be addressed not by individual organizations, but in collaboration and partnership with all of us in this forum. Over to you, Victoria.
Thank you, Dr. Issa, and thank you all so much. I do have the enormous task of summarizing such a rich conversation as such an in-depth needs assessment that Dr. Edwin and ChildFund, USCRI have put together. So I will start by saying, as a speaker on the panel, I also want to make it known that I'm also a learner on this panel, and it has been very informative hearing all of the questions, comments, information that you all have provided appreciated, and I look forward to our continued partnership together. And so within that messaging, I think the purpose of a call to action holds us all on this call and our peers accountable for where we go from here, to ensure that it's not just words, it's not just, laying out information, but that it turns into action and change. So I would say our call to action would target multiple stakeholders: governments, national agencies, UN bodies, community organizations, to which many to all of us fall into those groups, to address the urgent needs of unaccompanied and separated children identified in the needs assessment that was conducted across Garissa, Turkana, and Nairobi counties. So we want to transform these findings into commitments and interventions aimed at ensuring protection, education, health, and well-being for every affected child. And now I think we have the folks on this call to do that. We have RLOs, we have UN bodies, we have civil society organizations, community members. So I know we can do it. To go through a little bit some of the key findings that were presented today. There were many, but I wanted to highlight, we've mentioned a widespread presence of unaccompanied and separated children. I think it's quite obvious that this is a population that is in dire need of support and being heard, and being supported both financially and in their future goals and upholding their rights. We have identified multiple overlapping risks. So we've talked about things such as child labor, abuse, neglect, child marriage, risk of gender-based violence, sexual violence, trauma, mental health impacts. All of these things need to be addressed. All of them have intersecting vulnerabilities. And so I think it's important that we're really registering the overlapping nature of these risks. We have protection systems right now that are operating at a severely restricted reality. So we've had major cuts to funding, cuts to aid, programs have been forced to shrink or shut down altogether. And so it's weakened the protection systems that we have available for children. It's caused health challenges, education gaps, materials, be it menstrual hygiene materials, education materials, and then we have malnutrition crises, hunger crises, on the brink of starvation for some. So I think all of these things have to be considered when we're talking about what our actions are going to be. I think as a team, we've brainstormed some priority actions, and I want to touch on some of those, but then also, if we have any time, please do put into the chat box any ideas that you all have so we can have a collaborative call to action. Some priority actions that we've thought about have been, of course, activating emergency child protection systems. So establishing and strengthening case management mechanisms for unaccompanied and separated children, making sure that family reunification, community-based identification, that those are all strong and working. We mentioned child-friendly spaces, right? So making sure that children have spaces to be children and to be assessed for these protection gaps and trauma that they've experienced. We need nutrition and food security response. So implementing targeted supplementary feeding programs and food vouchers for unaccompanied and separated children households. I saw a question that we weren't able to get to, but about the World Food Programme's differentiated assistance model. So we're seeing significant changes to the way food aid is distributed and what's available. And so I think having action on that is critical. Psychosocial support and mental health, providing structured group therapy, counseling for children and their caregivers, education access. So making sure that unaccompanied and separated children are enrolled in schools, that school fees that keep so many from enrolling are waived, that we're able to provide accelerated learning programs and learning materials. We did touch on a lot about economic situations for caregivers. So supporting income generating activities and conditional cash transfers for households who are caring for unaccompanied and separated children. I think lastly, what I've heard that from quite a few folks in different ways is around data and accountability. So we've had RLOs on the call share that, look, we have the numbers, we have the information, we need the partnership and collaboration. And so that's something I know I am logging for myself. We've also heard about gaps in information. I think that's why we're all on this call, right? To hear what this needs assessment found, what were we able to put in writing, and how are we able to outline what these needs are. And so we need more of that and more opportunities to gather and speak. I don't know if anyone's put in the chat. I can check if there's anyone who would like to feed in to a call to action. I know we're on very minimal time, but wanted to provide just a second to see if anyone would like to feed in.
Yeah, I think I would also request the participants if they can allow us to extend by 5 minutes, please, so that we can have at least 7 minutes to discuss this call for action. So, Victoria, I think silence means that we have been granted 5 minutes, so you have 7 minutes to wrap up this. Over.
Excellent. Thank you for the extended time, everyone. I do want to provide that moment if anyone would like to feed in any input to the call to action. I'll give a moment.
This is free. You just raise your hand or unmute and speak. And also I'm giving the panelists also half a minute each, just to, if in case you need to add any perspective. Edwin, Jesus, Taylor, myself, anything you want to emphasize on the call to action as we wait for participants to raise their hands?
Maybe Isa, one of the things to add, which has emerged from the conversation here, is the whole discourse around the Ushirika plan, the Shirika plan, I mean, and how our call to action can also be able to ensure we reflect that as part of policy advocacy action based on any gaps that some have raised here, but also just making sure that we can monitor the implementation, because if we sit back, then it means we will come back and say there's nothing going on. The question about what has been done by one of the participants was very important, meaning that then if we have a monitoring process that allows us to ensure we're able to tell how that is progressing. So I think that will be an addition when it comes to policy action, and especially holding, we as non-state actors being in the forefront to hold the government to see how that is going on. Otherwise, if it's left like that, there will be mixed outcomes at some point.
Thank you. Thank you for that addition. I think that is quite spot on. Given the existence of these structures within the refugee camps and in the host communities, which are supposed to provide service and address the challenges of refugees, I think it's quite important. Any other comment from the floor or from the panelists?
Just, Isa, I think Victoria already mentioned a lot of the things that I think are worth highlighting about the assessment and the needs that we have found. But just as a call to action, also coordination between ourselves and between all the organizations that we are gathered today, I think that's something that's going to be important. As you know, the reductions of the humanitarian sphere are paramount and are really large, and we really need to come together to address the needs that we are identifying and that are increasingly getting worse. So this is something that is important, and it's part of the call to action as well. So I thank you for being here as well.
Thank you. So there's an idea here which is quite interesting, and allow me to read it. someone is suggesting an idea of an international exchange program, selecting 100 to 200 unaccompanied high school children to live with host communities around the world. Ask every government to host 5 children to be fully supported through 4 years of high school with a local family. It would allow refugee children to be ambassadors for the cause and possibly open door for an important future. So that is a suggestion and idea being shared here. Thank you very much for sharing the idea. I can't read the name. This is Christine Herman. Thank you very much, Christine Herman, for the idea. So we have almost finishing the 5 minutes we have borrowed from the participants, and I don't want to delay them much further. I will allow if there is one final thing somebody wants to say, and I give 1 minute for that so that I can close. Any burning issue to be presented in 1 minute? I think we are all satisfied, and it's a pleasure having all of you. We are now remaining with 90. At one time, we were almost 90 people. And this is a privilege to ChildFund and the USCRI. You have given us to listen to what we had to tell you based on our study assessment. And we are happy with your contributions. Thank you very much for the questions. And we'll go through the chat. If there are any questions which you might not have seen, we'll attempt to answer. We'll share with you our call to action, and we call upon you to add any ideas, make comments, so that we can make it much stronger and make ways of implementing the same in terms of ensuring that we address the challenges of the accompanied and separated children in refugee camps and also in Nairobi or in urban areas. Thank you very much, and God bless you all. Thank you.
Thank you.